If you have had a fall, the most important question is not just, are you okay? The better question is, why did this happen? And what can we change before it happens again? Stay with me, because by the end of this video, you will know the 5 checks that should not be missed and what to bring or say so the important things are less likely to be overlooked. Because after a fall, one appointment can feel very brief while another looks at the full picture. Some of these checks may be done by your GP or practice team, and some may involve a falls service, physiotherapist, occupational therapist, pharmacist, or another specialist. It may not all happen in one appointment, but these are the areas that should be considered. And of course, if there are urgent symptoms such as chest pain, stroke symptoms, serious injury, severe headache, repeated vomiting, confusion, or drowsiness after a head injury, seek urgent medical help. Hi, I'm Amged Khairy Selim, consultant geriatrician, older people's medicine, and welcome to Age Well with Dr. Amged. Then, how may need a fuller falls assessment? Not every fall needs exactly the same level of review, but a fuller falls assessment becomes especially important if any of these apply. You're living with sterility, you were injured and needed medical treatment. You blacked out or may have lost consciousness. You could not get up independently, or you have had 2 or more falls in the last year. If that sounds like you, it is entirely reasonable to ask, could we do a more complete falls assessment, or would a referral to a falls service be helpful? So here are the 5 checks that shouldn't be missed. A good falls review is not just one quick question. It often needs to look at 5 main areas. First, did you black out, feel faint, or get dizzy? We think about things like blackouts, feeling faint, dizziness, palpitations, or feeling wobbly when standing up. This is where blood pressure, especially lying and standing, can be very important, because sometimes a fall is not mainly about tripping. Sometimes it is about circulation, blood pressure, dizziness, or a medical cause that needs checking. Second, has your walking or balance changed? We look at how you move. That includes walking speed, steadiness, balance, getting out of a chair, leg strength, and whether fear of falling has changed the way you move. This matters because many falls happen when strength, balance, and confidence all start slipping together. What you look like when you walk is often clinically important. Third, are your senses and feet helping you stay steady? We look at the systems that help you judge where you are in space. That includes vision, hearing, feet, and footwear. Poor vision can make edges, steps, and stairs harder to judge. Hearing problems, dizziness, and inner ear conditions can all affect awareness, confidence, and balance. Painful feet can change gait, and unsafe shoes can turn a wobble into a fall. So a proper review shouldn't ignore the eyes, ears, feet, or shoes. Fourth, could medicines or health conditions be contributing? We look at the wider medical picture. That includes prescribed medicines, over-the-counter medicines, long-term conditions such as arthritis, diabetes, Parkinson's disease, or memory problems, bladder symptoms like urgency, or getting up several times at night. Because falls are often not caused by one thing. They may be influenced by a combination of medicines, health conditions, rushing to the toilet, pain, stiffness, or lightheadedness. And it may also include alcohol intake, because alcohol can affect balance, alertness, blood pressure, and medicines. And finally, are confidence, nutrition, memory, or bone strength part of the picture? We look at the things people often forget. That includes memory and thinking, mood, confidence and fear of falling, weight loss, poor diet or low fluid intake, and bone health or osteoporosis risk. Why does this matter? Because poor nutrition can lead to weakness and lightheadedness. Mood and memory affect safety and the follow through. And if someone does fall, bone strength matters because fracture risk matters. So a good falls review is not just about the fall itself, it is about the whole picture around the fall. And if the fall happened at home, it may also be worth asking whether a home hazard assessment or occupational therapy input would help. So you may ask how to prepare for the appointment. If you are going for a falls review, there are 3 very useful things to bring. First, a list of your medicines, including over-the-counter tablets and anything you buy yourself. Second, if practical, the shoes you fill in, or at least be ready to describe them. Third, a short note about what happened. Try to write down when it happened, where it happened, what you were doing, whether you felt dizzy, faint, weak, or rushed, whether you hit your head, and whether you could get up afterwards. That small note can make the appointment much more productive. If you are going with someone to the appointment, your rule is not to speak over them. Your rule is to fill in the missing pieces. For example, they have fallen twice this year. They seem dizzy after their morning tablets. They rush to the toilet at night. They are holding onto furniture more. They have become more fearful since the fall. Those details are often exactly what helps a GP, nurse, pharmacist, falls clinician, or therapy team spot the pattern. If you have had a fall, do not brush it off. Arrange a review with your GP practice, falls service, or the healthcare team looking after you. And if the story suggests more is going on, do not settle for a rushed "are you okay?" A fall should prompt the right questions. And remember, the answer is not always just a prescription. Sometimes the right next step is a medicine review, strength and balance exercise, checking lying and standing blood pressure, an eye check, footwear advice, or a home hazard assessment. So use this checklist to help make sure the important things are not missed. Because the goal is not just to recover from one fall, the goal is to reduce the chance of the next one. Stay steady, stay active, and I will see you in the next video. And please don't forget to subscribe to this channel so you don't miss the rest of this important series on staying safe and independent.